It is important for the massage therapist to use movement in a purposeful way to create a specific physiologic response. In an illustrated sketch of the movement cure, George H. Taylor presented some guidelines and recommendations for using massage techniques. 1. Be specific. 2. Be mindful of patterns of hyperactivity or too much, and hypoactivity or not enough. 3. Position the client purposefully. 4. Stabilize the body so that only the focused target area is affected. 5. You may move the area or cooperate in the effort with the client. 6. Be sure that the force and exertion are gradual and vary with the demand. 7. Remember that the purpose is to lengthen shortened tissue and tone weakened muscles. 8. You are a facilitator in the process. 9. Make sure the application is slow and purposeful. 10. Repeat the movement 2 or 3 times, but not to fatigue. The use of movement, as described in this video, follows the guidelines and recommendations described by Taylor. In active range of motion, the client moves the area without any type of interaction with the massage therapist. This is a good assessment tool and should be used before and after any type of joint work. Active range of motion provides information about the limits of the client's range of motion and the improvement that results after the work is completed. A second type of active joint movement is sometimes called active assisted range of motion. To perform this movement, firmly grasp and hold the end of the bone just distal to the joint being addressed. Lean back slightly to take up the slack in the tissue. Then instruct the client to push slowly against a stabilizing hand or arm, while moving the joint through its entire range. Hand placement with joint movement is very important. Make sure that the area is not squeezed or pinched. Place one hand close to the joint to be moved in order to both stabilize and evaluate that joint. Place your other hand at the distal end of the bone. This is the hand that provides the movement. Make sure also that when needed, your movement hand applies a straight traction before moving the joint through the range of motion. Always use proper body mechanics when performing joint movement. Avoid working cross-body. Stand with your thighs against the table while facing the client. Position yourself distal to the joint. The actual movement comes from your whole body, not from the shoulder, elbow, or wrist. The movements are rhythmic, smooth, slow, and controlled. You may pause the tape now to review active range of motion, or you may continue to the following section, muscle energy and proprioceptive techniques. Muscle energy techniques involve a voluntary contraction of the client's muscle in a specific and controlled direction against a specific counterforce applied by the massage practitioner. When doing muscle energy techniques, it is important to position the specific muscle you are working on so that the origin and insertion are either close together or in a lengthening phase with the origin and insertion separated. These demonstrations show various muscles in contracted positions. Practice isolating as many muscles as possible, keeping in mind that the proper positioning is very important. Make sure that the muscles can be isolated regardless of whether the client is in a supine, prone, or side-lying position. In using muscle energy techniques, the amount of effort exerted may vary from a small muscle twitch to a maximal muscle contraction. The duration of the contraction may last from a fraction of a second to several seconds. All contractions begin and end slowly, gradually building to the desired intensity. There is no jerking in the movement. There are two neurophysiologic principles that explain how results can be achieved through the application of physiologic laws rather than mechanical force. These are post-isometric relaxation, or tense and relax techniques, and reciprocal inhibition. Post-isometric relaxation occurs naturally after a contraction of the target muscle is over. Tense and relax techniques involve the application of post-isometric relaxation after the contraction. These two terms are commonly interchanged in many bodywork texts. The following is a tense and relax sequence for the gastrocnemius and soleus muscle group. First, assess the target muscle to determine the limits of the restriction. Next, lengthen the target muscle to its barrier. Then, back off slightly. Next, tense the target muscle for 7 to 10 seconds. Now stop the contraction and lengthen the target muscle. Repeat these steps until normal full resting length is obtained. The second principle is reciprocal inhibition, which takes place when a muscle contracts, causing its antagonist to relax in order to allow normal movement to take place. First, assess the target muscles to determine the limits of the restriction. Next, isolate the target muscles by putting them in passive contraction. Then, have the client contract the antagonist muscle group. Now stop the contraction and slowly bring the target muscles into a lengthened state. Stop at any resistance. Next, place the target muscle slightly into contraction again. Repeat these steps until normal full resting length is obtained. The principle of reciprocal inhibition can be used effectively to soften a muscle so that it can be massaged at its deeper levels. The following procedure works reflexively to make a soft muscle. Isolate a target muscle or muscle group by putting it into passive contraction. Place the hand that will massage the soft muscle on the target muscle. Place the other hand so that you may contract the antagonist muscle group against resistance. Then, have the client actively contract the antagonist muscles against the stabilization. This causes the target muscle to soften. You may pause the tape now to review the techniques just covered, or you may continue to the next section on pulsed muscle energy procedures. Pulsed muscle energy procedures involve engaging the barrier and using small resisted contractions to introduce mechanical pumping. Begin by assessing the target muscle to determine the limits of the restriction. Then, isolate the target muscle by putting it into passive contraction. Apply counterpressure for the contraction. Then, Instruct the client to rapidly contract the target muscle in very small movements, about 20 repetitions in 10 seconds. Slowly lengthen the target muscle. Repeat these steps until normal full resting length is obtained. There are instances when the client does not wish to or cannot participate actively in the massage. The principles of muscle energy techniques can still be used by direct manipulation of the spindle cells or Golgi tendons. First, assess the target muscle to determine the limits of the restriction. Then, to initiate relaxation by direct manipulation of the spindle cells, begin by placing the target muscle in comfortable extension. Then, press the spindle cells together on the target muscle. Next, pull the spindle cells apart on the antagonist muscle. Now, lengthen the target muscle. Repeat these steps until normal full resting length is obtained. For direct manipulation of the Golgi tendons, again begin by assessing the target muscle to determine the limits of the restriction. Then place the target muscle in comfortable extension. Next, pull apart on the tendon attachments of the target muscle. Then, push the tendon attachments together on the antagonist muscle. Now lengthen the target muscle. Repeat these steps until normal full resting length is obtained. Positional release is another relaxation technique. Its emphasis is the use of tender points to guide the body into a position where the muscle tension can release on its own. To begin this technique, locate the tender point by gently initiating the pain response with direct pressure. Then, slowly position the body until the pain subsides. Now decrease the pressure being applied, but do not let go of the tender point. Remember that you are not treating the point, merely monitoring it. Wait at least 30 seconds or longer until the client feels the release. Then slowly move the muscle involved into an extended position. Repeat these steps until normal full resting length is obtained. You may pause the tape now to review the techniques just covered, or you may continue to the next section, stretching. Stretching is a mechanical method of pulling connective tissue to reduce tensile stress. In this section, we will demonstrate 3 different stretching techniques. Longitudinal stretching, an alternate method for longitudinal stretching, and cross-directional stretching. Longitudinal stretching pulls connective tissue in the direction of the fiber configuration. To begin, position the target muscle in the direction of ease, the direction that is easiest to achieve, and stabilize and isolate the muscle group. Perform an initial assessment to evaluate the range of motion of the jointed area. Before beginning the actual stretching, lengthening must be done to normalize tone in the muscle and to prevent protective spasms from occurring. We are using post-isometric relaxation. Once prepared, lengthen the muscle to its physiological barrier, or wherever a protective contraction is engaged. Stay in line with the muscle fibers. Have the client inhale, and then stretch the tissues on the exhalation. An alternate method for longitudinal stretching can be used for small sections of a muscle in two conditions. The first is when the muscle does not lend itself well to stretching with joint movement. The other is when the joints are so flexible that not enough pull is put on the muscles to achieve an effective stretch to the tissues. To perform this technique, locate the area in the muscle to be stretched. Place hands, fingers, or forearms in the belly of the muscle, or directly over the area to be stretched. Contact the muscle with sufficient pressure to reset the neuromuscular mechanism. Then separate fingers, hands, or forearms, or lift tissue with enough pressure to stretch the muscle. Take up all slack from lengthening first. Then increase the intensity slightly, and wait for up to 30 seconds for the connective tissue component to respond. Cross-directional tissue stretching uses a pull and twist component. First, access the area to be stretched by moving against the fiber direction. Then, lift or deform the area slightly and hold for 30 to 60 seconds until the area gets warm or seems to soften. To perform cross-directional stretching on skin and superficial connective tissue, locate the area of restriction. First, move into the restriction and then separate the hands or forearms, keeping a constant tension on the tissue. Proceed slowly. Take up slack until the area warms up and softens. Efficient use of massage techniques reduces the need for labor-intensive applications of massage manipulations. By actively involving the client in the session, more effective results can be achieved. As you have seen in these demonstrations, a thorough knowledge of muscle isolations and joint functions is necessary to increase your expertise in these techniques.